They certainly can take steps to avoid type 2 diabetes. Prediabetes is diagnosed when an individual's blood sugar is between 100 and 125 fasting on 2 occasions. There are other diagnostic criteria that can be used also, but that's an easy one to look for. The person with prediabetes has resistance to their insulin. They're making insulin. They may actually be making more insulin than a person who does not have prediabetes, but their body doesn't use it well. So their pancreas continually is trying to put out more insulin to bring down blood sugars, but they still are making enough that they are not actually diabetic. A fasting blood sugar of 126 or higher on 2 occasions or more is one of the diagnostic criteria for actual type 2 diabetes. So what you have with prediabetes is a person who is able to make some lifestyle changes to bring down those blood sugars. One of the major factors with insulin resistance is excess body weight. Losing even 5 to 7% of your body weight when you're overweight can help you to reduce your blood sugars. Getting more exercise, getting daily exercise, even exercise 3 times a week, that is more than what the person has been getting, has been shown to lower blood sugars and bring them back down into the normal range. So weight loss, healthy diet, exercise is how a person with prediabetes can help to avoid type 2 diabetes. Now there's genetic tendency at play. As with everything else, a person with type 2 diabetes and a person with prediabetes probably has a strong genetic tendency to have high blood sugars. So there's not a guarantee that a person can necessarily prevent developing type 2 diabetes, but they certainly can postpone it until much later down the road in life, which helps to prevent complications, certainly. And many people can avoid entirely becoming diabetic by making lifestyle changes. Very important. Basically, the recommendations for a person with prediabetes are very similar to what we recommend to a diabetic. The only real difference there would be that a person with prediabetes will not have to manage their carbohydrate intake quite as carefully as some of the diabetics have to. They're not going to be on a medication that could possibly cause their blood sugar to drop too low. So they may be able to eat a little bit more flexible meal schedule and vary their carbohydrate intake a little bit more than some of the diabetics can and not have a problem with that.